Seclusion is one of the many interventions that are used in mental health setting, especially in acute mental health care. Frenton Saylor's 2012 states seclusion and restraints are used in treatment and management of aggressive or violent behaviors in psychiatry. Seclusion not only protects patients in many ways, but also the healthcare providers who are looking after them. Seclusion is more commonly applied on patients with serious mental illness, such as schizophrenia and bipolar disorder, as they are at higher risk of aggressive or violent behaviors. However, evidence have shown there are significant adverse effects of seclusion. Hence, it is regarded as a last intervention to apply. Policy and procedures have been established to ensure patients' human rights will not be breached. It is also nurses' role to monitor the patient's physical and mental status before, during, and post-seclusion.
The state government of Victoria 2011 defines seclusion as the restriction of a person's activity at any time, day or night in a specific room with the doors and windows locked, which delivers an isolated circumstance for a particular person from the outside. Saylor and Fenton 2012 state seclusion is usually applied in psychiatric setting to manage patients' aggressive or violent behavior. Violent incidents can occur at any time without signs and symptoms or signs that are hard to identify, such as patient being uncooperative in emotional management and self-control, being potentially harmful to self or others regarding to patient's medical history. One-to-one nursing care might be applied on high-risk suicide patients during seclusion. To reduce violent incidents from happening, seclusion is an immediate but temporary interventions to ensure staff and patient safety. It provides a less provocative environment for patients to remain in calm and regain control until physicians approve to cease. Seclusion should not be used as a punishment. It has to stop as soon as possible once a person is mentally manageable. Victorian Department of Human Services 2007 suggests that seclusion has a third effect on a person who is receiving it, which include psychological or physiological influence. For example, it might trigger their anger and develop hostility against others. Legal acts and hospital guidelines has established to protect the patients and staff from unnecessary harm associated with seclusion. Therefore, when performers wish to perform seclusion, they might comply with the Mental Health Act 1986, Section 82, and the Charter of Human Rights and Responsibility Act 2006, Section 38, to protect human rights and legally perform seclusion on patients.
As mentioned above, seclusion is considered as the last coercive intervention to manage serious mental illness in order to reduce the risk of injury, not only patients but also nurses. According to Chiba, Subramani 2015, aggression, risk of violence, and user safety are the most three common reasons for seclusion. Adlinger et al. 2014 claims that patients with schizophrenia are 5 times higher risk of violent behaviors than general population. Also, Chiba and Subramani's 2015 study shows 31.4% of patients with schizophrenia have been secluded, with 83.3% reported physical aggression and 50% with risk of violence. Indeed, Adlinger et al. 2015 believed people with bipolar or personality disorders are more likely to be reported in aggressive behaviors. The study of Chiba and Subramani 2015 also shows a total of 40% patients who were secluded for verbal aggression had a diagnosis of bipolar mood disorder, especially in manic state. Paranoid ideation and perceptual or behavioral disturbance might account for the agitation behavior in patients with schizophrenia or bipolar mood disorder, according to Chiba and Subramani 2015. As a result, patients suffering from schizophrenia or bipolar disorders are likely to be secluded due to their risks of harming themselves and other health staff. In addition, the study indicates 18.6% patients with schizophrenia were excluded for their own safety. Cognitive impairment and dementia are the two most common reasons involved. Patients with cognitive impairment and dementia may be more likely to be abused or assaulted by other patients in the world. Therefore, seclusion is a necessary coercive intervention to protect both patients and staff. Once other less restrictive interventions are excluded, seclusion becomes an inevitable choice. Holmes and Jacob 2007 claimed that patients' basic human rights needs to be protected. Nurses should acquire informed consent from patients or their authorized family members before initiating seclusion. Nurses should also develop care plan for the patient in seclusion to fulfill individual needs, patient's physical and mental status. Management of potential risks should be taken into account during seclusion. At the same time, nurses also need to maintain patients' food and fluid intake, administer medication, and arrange patients' hygiene and toileting. According to Chief Psychiatrist's Guideline 2011, a psychiatrist needs to examine the patient at least every 4 hours during seclusion to ensure the patient is clinically safe and comfortable. Nurses should observe, assess, and comprehensively review the patient regularly. The time interval to review the patient is every 15 minutes or even shorter if necessary. By observing the patient through the observation channel on the door, nurses can monitor patients' physical condition, such as posture, level of consciousness, potential side effects of medication. Mental state examination and risk assessment tool can be used to assess patients' mental status through analyzing patients' pattern and content of speech, their mood, and level of motor activity. All these factors can be indications of whether the episode of seclusion should be continued or ceased. Holmes and Jacob 2007 point out that patients in seclusion may feel frightened, angry, and isolated. Nurses should have a responsibility to provide education to appease the patient by explaining the reason of seclusion is to ensure everyone's safety. Information should be provided, such as what will happen during the intervention and when the seclusion will be ceased. Patient who has difficulty facing distress post-seclusion can be referred to consultation and supportive service.
In conclusion, seclusion is the last intervention for treatment and management of aggressive and violent behavior. It can ensure the safety of not only the patient but also healthcare providers. Schizophrenia and bipolar disorder are two common mental illnesses that involve higher risk of harmful behaviors in mental health settings, as cognitive impairments and dementia are two major factors of seclusion. In order to apply seclusion effectively, minimize possible adverse events, and protect basic human rights, nurses and other staffs need to comply with legal requirements and organization policy and procedures. Nurses also play an important role throughout the whole seclusion process, ensuring informed consent and required legal documents have been completed before the seclusion, monitoring and assessing patients' physical and mental status during the seclusion, and provide supportive care post-seclusion. Hence, ultimate outcome can be achieved, as well as preventing possible adverse events from happening.